As far as hair loss is concerned, there are about 40 different types of hair loss. And in certain types of hair loss, regrowth is possible. And in certain other types of hair loss, regrowth is not possible. So for this, we have to first understand what is the diagnosis of the type of hair loss that the patient has. We do a microscopic check here, and then we come to the conclusion on what type of hair loss it is. And then we decide on the line of treatment, and we commit whether the hair growth is possible or hair growth is not possible. For example, in alopecia areata, we can definitely assure that all the patients will have a regrowth with medicine or sometimes even without medicine. Many cases in 3 or 4 months itself, the hair regrows in alopecia areata. But it may not happen in all the cases, and that is when medical intervention is required. In alopecia universalis, very often homeopathic treatment will be needed. Remedies like tuberculinum, syphilinum are used in this condition, and even phosphorus. Alopecia areata is again successfully dealt with fluoric acid, phosphorus, niserium, and even we have remedies like lycopodium and silecia, which is used in the treatment of patchy hair loss. Alopecia areata is a type of a patchy hair loss. Alopecia universalis is the type of hair loss which affects the entire scalp, where the immune system is doing damage to the complete hair follicles. So the autoimmune process has to be corrected by defacing medicines. We have a detailed case analysis done for these patients, and based on that we assess what remedies to be given. In androgenic alopecia, which is the most common type of hair loss, we call it as a male pattern of baldness in men when it happens, and we call it as female pattern of baldness when it happens in women. And in this type of hair loss, we have to go for a constitutional approach, because a certain amount of change is possible. We can arrest and slow down this process. We can improve it to some extent. With homeopathic treatment, we can get a 5 to 10% improvement, or in certain cases it just stabilizes the condition. In certain cases there may be a 5 or 10% reduction also despite the hair loss. But in all the cases, the stability which you achieve, where you regrow whatever you are losing, once that capacity is come back, then these patients also retain that hair for several years after the treatment. The patients that I have treated in 2002, 2003 are still able to kind of maintain their hair even after 20 years or 15 years. So this kind of ability to sustain the hair on top of the scalp in androgenic alopecia for a long period is what the homeopathic medicine gives you.